BooBoo. Okay, we're live, and even before the phone is telling me I'm live, I already have BooBoo Kitty saying hi. So, hello, BooBoo Kitty. And I do believe that, BooBoo, you'll be participating in the Google Hangout for the month for patrons tomorrow. I think that's at 8 o'clock our time. What time would that be your time? 11 o'clock your time. So, thanks for coming, and thank you everybody else who's shown up. Cheryl McNutt, hello, doctor. For those of you coming in after the live recording, you want to go on down about 2 minutes into this because I'm just going to be greeting my friends as they come in here, and we'll be talking about, at that point, talking about choosing your own doctor. And those of you who don't know how to get these, I'll try to put something in the description that describes how to turn on the little bell icon on the Auburn Medical Group channel on your YouTube and set up your settings so that you will get the announcements when we go live. This is actually the second attempt to do this one live this evening. The first one somehow did not work. And Cheryl and BooBoo are saying hi to each other. We've got building community is what we're all about here. So I'm glad that you guys are getting to know each other because you're regular, I was going to say regular faces, but we really don't have a whole lot of faces. Well, we have this face, but your face is not a whole lot of it. One thing I want to do is, if you can, help me. If you're comfortable with it, please tell me your age. And if you're not comfortable with it, please tell me a range. And if you're not comfortable with that, go ahead and make it a big range, like a couple decades. But as comfortable as you can be, as specific as you're comfortable with, I should say. Let me know how old you are. Finally, early notification for a live. Yes, you got it. Good, and you're here. And Bernadette Blair is saying hello, and Frantice tells us she's 39. Shell McNugg says she's 53. Susie Hopper says she's 54. And McNugg says she's 19. Bernadette Blair says 46. Okay, so that's probably about what I'm thinking on the channel at large on YouTube. And Teresa D is 52. It's a bell curve of ages, and the biggest is at 25 to 35, and then it goes down from there in each direction, both older and younger. His sibling's 72. Laura E is 49 from San Diego. Sunny San Diego. Dr. Gwaine just had a birthday. I know how old he is. And thank you for coming. It must have been the title that got your attention for this one, right, Dr. Gwaine? Lynn Tisgnot is 48, moving cross country, and this topic interests me a lot. Good, very good, very topical topic. BooBoo, I'm just not playing his game. Oh, that's fine, BooBoo. Cheryl McNutt, happy birthday to Dr. G. Yes, thank you for doing that, Cheryl. That's very kind of you. And Bernadette saying happy birthday to Dr. G also. And this is all based on Dr. Gwaine's blog post at the drgreenknight.com blog. Teresa D is telling you happy birthday too. I guess you can see, yeah, you guys can see each other's chat. What am I saying? So Dr. G can see what's going on there. The topic on the blog, yes, choosing your own doctor. And I'm sorry, I already forgot whoever it was who's moving across the country. So this is a pertinent thing right now. Would you guys tell us your account of how you chose a doctor? If there was a time that there's a specific thing that drove you to a certain doctor, or that made you want to have a certain doctor as your doctor, let us know what that was. This sibling says, I moved to a new city last year and had to find a new doctor after 20 years. Shell McNutt, hard to get a doctor here. Oh, that's one factor I wasn't even thinking of, is they have to be available to be able to get one. Sometimes it's just a matter of who's available. Fran T. A non-judgmental doctor. Now, how are we going to know that? Let me see. How can I say it in this most judgmental way possible? Fran, what were you thinking? How are we going to know that ahead of time? No, seriously, though, how would we know? How would we know that a doctor's non-judgmental? He's going to work with you regardless. And if you're disappointed in something, how are you going to, or how is that going to be not having a feeling like your doctor's disappointed in you? Yeah, she said I got the vibe. That's right. Thanks, Fran. Teresa D. An interest to me, my doctor passed away, and current doctor suggested by a pharmacist. There you go. Somebody got a pharmacist. Teresa says the pharmacist suggested her doctor. And Laura says she looks for reviews on Yelp. There are doctor reviews on Yelp. Dr. Gwaine and I have found there's actually more reviews somewhere other than Yelp. And we'll get into that in a little bit. Maybe Dr. Gwaine will chime in with that. We'll see. Because there are many, many ways that you can get reviews on doctors online. Oh, also, just to say to you guys, if I'm not getting to your comments because it's already filling up faster than I'm able to get to, please do use the super chat function. That's the little $sign. That will get you noticed. No kidding. But yeah, for now, okay, Fran says word of mouth. And that used to be the biggest. I don't know if that's still the case. It probably still is the biggest, but online certainly is catching up to it. Susie Hopper took a recommendation from a friend. There you go again. That's the word of mouth, his sibling. Difficult to find a family doc in most parts of Canada. Saw an ad in the paper that a family practice teaching unit at the nearest hospital was taking patients. And wow, can you guys hear that bird? Man, that's loud. Yeah, teaching hospitals. The teaching situation in medicine, there's good and bad to it. The good is you can get a student or an intern or a resident or nurse practitioner or somebody who's, I shouldn't say nurse practitioner in training, somebody who's still in their training who will have more time because of where they are in their training to give you more attention, to go over things in greater detail, more time with that person who cares about what's going on with you. Then there's the bad side too. They're not as experienced and the supervision varies from place to place. By the way, this is bugging me, so I'm just going to let you guys know. You see the ends of the fence here? There is a slope. I don't have my phone on level. It's the slope that the fence goes down, so that's why I'm upright. Otherwise, I'd be like this. So that was distracting me. Sorry, guys. T. Long, hope all is well. We hope it is for you, too. We're talking about picking your doctor. Teresa thinks the birds are lovely. These are kind of loud and annoying birds, but they are lovely nonetheless. His sibling had previously been a patient at a family practice unit, liked it, hoping for it again for many reasons. Susie Hopper said it took recognition from a friend, and I think there were some comments back here I may have missed earlier. Would love to have Dr. Like, oh, that's very nice, Cheryl. Fran T, not rush me or brush me. I'll get to the point, Fran. Yes, we don't like them to treat us that way, do we? Cheryl McNutt, 15 minutes is the time my doc gives. Does he time it? I actually heard of, there's a doctor in our town who does time. You got 15 minutes. And once that time's up, they're on to the next room. Which, actually, let me give you a little perspective from this side. That's somewhat attractive because you schedule patients out for the day. You say, okay, we've got time slots so big. Whatever time you spend in the room, for those doctors it's 15 minutes. For us it's probably longer. Plus, you budget some time for getting caught up on labs and messages and documentation of the note. And you know that you've got this next patient in the room, and you know that people, by word of mouth or online reviews, are going to be dinging you if you don't get to them on time. So you feel a little pressure. It's not that you have something you need to get to, it's that it's a person with needs who's waiting in the next room. So that's where some of the time pressure comes. So of course you could say, well, don't schedule so many patients, allow more time for appointment. That would be nice. We'd be more relaxed if we did that. In our practice, dealing with the financial realities we do as an independent practice, can't. Sorry. Maybe some specialists can because they have more coming in for their procedures. But in family medicine, it's all we can do, to still exist as independent family practice. Used to be everybody was, but the economics of medicine have made it so there's less. And so that's some of the pressures that you're seeing from the patient side that you guys are observing. Canadian family practice, family physician, doctor, not a student, Teresa D. Being close to Houston, we have a lot of University of Texas docs. Yes, you do. And you can see people in the teaching hospitals in the Houston area because you have that one place where you actually have two medical schools right in the same area. I miss the type of family practice I went to years ago. Bailey Girl Smith, gee, I'd be thrilled with 15 minutes. I'd be even more thrilled if I could see the same doctor for each visit. No doctor knows my history. That's where a smaller independent practice would be nice because there's not so many doctors that it could be. It's narrowed down to just a few when you have that. And many practices, like ours, we try pretty hard to let people stay with whoever it is they establish with, whether that be the doctor or the nurse practitioner or the physician assistant, so that they do have somebody to have a relationship who knows them. I know that when I'm covering for either Dr. Gwaine or for Jennifer, it's not as comfortable. I mean, it's nice to meet somebody new. I like that and like to know all the patients in the practice. But on the other hand, they know what's going on. They know why they chose a particular plan of care they did when they saw the patient and not a different one. they probably had in mind what they were going to do if they had to change the plan one way or the other, based on how the patient responded to a treatment. So it's nice for us also to have that consistency of the same provider from visit to visit. Cheryl says walk-ins are the most common. Walk-in, you mean you're having walk-in appointments, or walk-in patients are most common? Our practice, we don't really call it walk-ins, we call it same day, because if you just walk in, you know, we have appointments with patients. We don't have spaces open because they get filled up in the mornings usually. But we do try to have spaces open same day for people if they call up in the morning or the afternoon, so we can get them in for stuff that comes up, because a lot of medicine, a lot of it's stuff that comes up. So we like to be available for that. Hopefully we'll be even more available for that once we get a nurse practitioner or physician assistant added on, in addition to Jennifer and to Francis too, who's going to be doing a couple days a week coming up, probably by fall. Cheryl, you say, oh, walk-in clinics. Walk-in clinics are the most common. Not sure. They are common, yes. Common, and kind of a strange phenomenon, that the evolution of the walk-in clinic. It's, you know, doing things that don't require an emergency department but come up, or urgent care is sometimes what they're called. We try very hard to take care of our patients. I think the reason those things exist are, one, because people don't have a primary care doctor, and two, if they do, they're not able to get in because they're already booked up. So it's quite an effort to open up your schedule for the same day appointments for your own patients, but it's so rewarding to be able to take care of your own people. Also, same day stuff is actually, in some sense, more relaxing than appointments, because you're able to kind of focus on what they're there for that day. And when other things start to come up, or you reach for the doorknob and there's the, oh, by the way, doctor, what about this, blah, blah. It's a lot easier to say, you know, we'll make an appointment for that. Today we were able to get you in for your arm being on fire, and we put it out. So we're happy to do that, and we look forward to taking care of the, oh, by the way, that, you know, it was brought up as my hand was on the doorknob. BooBoo, like my doctor, but sometimes feel up and just rush through. Oh, I'm sorry. Laura E., when I can't get an appointment on the same day, just go to the Minute Clinics CVS. That's becoming more and more common for our patients. I know that's very convenient for a lot of patients. We really hope that our patients will not have to do the Minute Clinic CVS, that we'll be able to take care of them in our office and have that continuity of care, and so we can see them, and so we know what's going on with them. We care about what's going on with our patients. True, thanks. I'll find a new doctor in Phoenix, 170 miles away, but would be worth it. Shell McNutt, arm fire. Hey, it happens, you know. Dr. Gwaine, should we start talking about other sources of information about a doctor? We had Yelp mentioned, and I did hint that there are other ways that they can find reviews online. I guess I'll go, I don't even know if Dr. Gwaine is still there or not. He's probably basking in all of the revenue that's just pouring in from people reading the Dr. Green Knight blog. I think that's probably what's going on. He's probably laying on a bed of money. Anybody watch Breaking Bad? You know what I'm talking about? The block of just cash 3 feet high or whatever. That's probably what Dr. Gwaine's doing, just rolling. In fact, he's probably doing it naked. He's probably rolling naked in the money that's just rolling in from the Dr. Green Knight blog. I think that's why he's not commenting. But okay, so we'll get to other sources of online reviews for doctors. So somebody mentioned Yelp, because Yelp has everything. And okay, word of mouth also is very common. Oh, Audrey's here. The ways with me, I'm not happy with my primary doctor because of the long waiting period. Laura E., laughing at probably the image of Dr. Gwaine. And Cheryl loves the blog. And back to Audrey just for a second. Being so long, how do I find the perfect primary doctor? Okay, so in addition to word of mouth in Yelp, we have found that there's more online reviews instead of Yelp with one called Health Grades. That one usually comes up pretty high in the searches for a doctor in your area. There's another one called Vitals, but it doesn't seem to have as many as Health Grades. What else has reviews for doctors? Oh, insurances. Insurance websites will sometimes have it. CMS, Center for Medicare Services, Medicare, will be having online, in fact, they may already have it, online reviews for doctors, or this may be what's coming up with the changes that we're going through right now with MACRA, that they'll have actual numbers that you can see the performance of your doctor at keeping people up to date on their testing, their screenings, how well controlled their patient's blood pressure is, how well controlled their patient's diabetes is, how good they are at getting their patients screened for colon cancer, breast cancer, cervical cancer. Notice I didn't say prostate cancer. No, that will not be one, because we don't have good screening. You guys have heard me talk about that before. Laura's familiar with health grades. His sibling rate Oh, okay, I didn't even know about that one. Rate MDs, there's another one. Yes, his sibling, that's a good one. Oh, so you've heard of that one too. They're a little scary to doctors, just like Yelp is a little scary to businesses, because you always imagine having a disagreement because of, if it's all about customer service, it wouldn't be a problem. But if it's about doing the right thing and doing what's best and using your knowledge as an expert, sometimes there's people who don't like and you don't connect with what the plan is. And so you have this concern that, oh man, it just takes one of those to sabotage the reviews, and that will bring, especially if you don't have that many, it's just going to plummet the scores down. So that is a very real concern for anyone that gets rated on online ratings, whether it be Angie's List or Yelp or a doctor on a medical one. But you know what? It's something you just got to do. And one strategy to try to help with it, which I should be better at, is going ahead and encouraging patients to make reviews. That way, one bad review is going to be much more diluted and won't make as big of an impact if you just ask people. And of course, if you do ask them, and this has been my experience, this is why I'm probably not good at asking. If you do ask people, you're going to get, you're doing well probably if you even get 1% to actually follow through with it. BooBoo says, too many trolls on those rating sites. They do exist. And what's interesting is I actually have some good reviews on Yelp that I can see because it's my account that Yelp won't let through. They think that they're fake, and they're wonderful. And I'd love to have them on there. My rating would look really good if those were on. But and I know who the patients are who wrote them, and they're real patients. But they don't like that. They think that there's something that just sounds a little too good on it, or suspicious, or not specific enough. But they have some kind of a criteria that they use on comments on Yelp to either let them on or not. And I guess you can appeal it somehow. And BooBoo saying something about Donna. I don't know who Donna is, unless you're talking about patient Donna. But I don't think I have a patient named Donna on a video. Anyway, thank you so much for joining us. Thank you, Dr. Gwain, who chimed in earlier. I do encourage everybody to use the link in the description to check out the Dr. Green Knight blog on this very topic. There's still information to be had from reading that. I didn't cover everything on it. He used a stock picture this time. I'm a little disappointed about that. He didn't have much time to get a picture for this one this week. So, and you guys, I'm trying to think. How would you guys send in pictures? Let's think. How would you do that? How would you send in pictures? I suppose you could post them on the Auburn Medical Group Facebook to show Dr. Gwain your pictures if you wanted to do that. So, you're welcome, Lynn. Thank you. I didn't know you were here. That's the first time I saw your name in the picture. So, until next time, Dr. Mark Vaughan telling all of you to stay in good health, and thanks.